Welcome to another edition of Great Health, Abundant Happiness, and Outrageous Love. Mwah.
Love those lips.
We got some great news, didn't we, hon? Yesterday.
The
Yesterday,
best
it's fresh.
possible news that we could have gotten. I want to throw a caveat in there because I want to give the caveat first.
Okay.
And then you can tell about the rest of the news. So the caveat is, and just to bring everyone up to speed, for those of you who have not followed, Jeffrey is going through immunotherapy for melanoma across his top lip. And again, we've said this in so many videos that if this were anywhere else on his body, he would have just had the surgery and had it removed. But this,
I almost did across the top lip too, for the record.
Right. Well, we went to many doctors, and they all told us the immunotherapy, they had not seen any success with immunotherapy.
Well, surgeons told us that, right?
In this area,
yeah.
which is across his entire top lip. And their recommendation, and it wasn't just one, it was several doctors, their recommendation was to essentially remove the top lip, which would have involved a lot of follow-up surgeries, because it's not just an aesthetic thing, which it would have definitely been that, but it would have affected speech and eating and drinking, and so there would have been a lot of follow-up.
Sipping wine, kissing my wife, all those things. Right. That's the thing, right?
All those things.
But anyway, we didn't go down that path.
We didn't go down that path. So yesterday, the reason is because one of our doctors, who's also a surgeon, and really elected not to treat Jeffrey with surgery, and sort of kind of pushed, I don't want to say he pushed us off. What he did was he gave us a bunch of different doctors to talk to, colleagues, and he said, ask them about anything other than surgery. Because he already is a Mohs surgeon, which is a surgeon that does, melanoma surgery. And we kept asking about, what about immunotherapy? What about immunotherapy? And we were really getting a roadblock here in Colorado. So instead of stopping there, because we really felt that, we could take control with the immunotherapy, and immunotherapy doesn't work for everyone. I believe it's a 20% chance, but Jeffrey was 120% committed to immunotherapy, which, it uses your own immune system. So what he did was he gave himself the best possible chance at healing by eating properly and not having any sugar, not having any gluten, all of the things that we know cancer feeds on, building up his immune system and eating foods that build your immune system and being very, very healthy and active, etc.
Yeah, I was just going to say, for those that don't know, with immunotherapy, what happens is cancer cells hide out and your immune system doesn't see them. They look like they're incognito. So it highlights the cells. So my own immune system would attack them and go to work. So it's real important to understand, yes, you have to really beef that up, and a lot of it has to do with, I think, all the good vibes we got. We met with healers. I've been doing intermittent fasting, yes, eating all the right foods. We researched everything. Anything that looked like it beefed up T cells and fought cancers, that's the way I went. We're 100% plant-based, I think most of you guys know. So we're eating 100%.
And 100% organic as well. And that was really important during this time. Sometimes in the past, if we had gone out somewhere, you just don't know. But we have taken full control of every single morsel that has gone into your body. And, we've done Reiki and, or Reiki as
Reiki is the traditional. That's that we've westernized it. It's called it Reiki. So you were calling it right all these years.
Yeah, well, it was.
There you go.
So we've been doing all of that, and as Jeffrey said, meditation and
the positive vibes from you all.
Positive vibes. I have to tell you, the amount of people that were pulling for you to have this immunotherapy work, it just. Near and far, people people you've never met, and people that we know that have told other people they've never met, that have told other people. And I just believe that every single day when we talked about that, and somebody would say, I'm praying for you, and even, today you got a text that says, prayer does work. And it doesn't have to be a religious prayer. It can be a spiritual prayer, or just positive vibes, whatever it was.
Right.
It worked.
Right.
It
right.
worked. So the caveat I'm going to tell you is that the doctor recommended that Jeffrey do a second round of immunotherapy. You know, he didn't feel like we needed to do it immediately today, but Jeffrey, I believe, is going to start in the next couple of days.
We're going to start Monday.
I think Monday, so that you know, so that we can be done with it. It's going to be another 6 weeks, 5 days on, 2 days off, and we'll probably document that as well for anybody else. And our learning and understanding is very few people do one round of immunotherapy, so this is not uncommon.
Right.
And the reason that he wanted you to do the second round is when they looked at it and we thought they would take a biopsy, they said, we do not visibly see any melanoma to biopsy. So that was huge news.
Yeah.
But there could be microscopic remnants, you know, beneath the surface. And that's what they want to make sure that this second round takes care of that. And they're confident that this will be it, right? And you'll just be checked every 3 months, which is very standard for anybody who has a melanoma.
Exactly. And, you know, the reason why I want to share this whole journey is because, you know, I feel like I've dodged a bullet. I mean, the doc said, we may have just, avoided an unnecessary painful surgery, significant surgery. So the reason why I want to share this, you have to be a self-advocate for yourself. I mean, when I say I was this close, you know, I'm sitting in with surgeons and talking about it. I'm like, oh my God, it doesn't sound very good. You're going to take off a lot of lip, was a comment from one doctor. You know, well, we got to get rid of it. I mean, you know, I was this close to saying, okay, good, put me on the schedule. And we just kept doing the research and kept digging. You have to be a self-advocate. So we want to share this positive story because, you know, we're not completely out of the weeds yet, but I guess, you know, for the most part, we feel like we are, but we've got this last 6 week journey.
Exactly. I'm calling it I like to think of it as a seatbelt, you know. It's one of those things that maybe if you didn't do it, you'd still be fine. We don't know, but Jeffrey is going to strap himself in and wear his seatbelt so he is, you know, 100% sure that if there is anything left over, this second round is going to take care of it. Right.
And then moving forward, anybody that's had a melanoma or had friends or family that had melanoma, you have to go in every 3 months to the dermatologist to get checked. So if anything ever pops up again, certainly in that area, they would do a biopsy on it and check again. So it's, you know, it's something we have to watch, but we're very, very excited. We're very thankful for all of the great vibes you guys sent. We really appreciate it. We can feel it. I can feel it now. It was just great.
Really, we have had just chills over, you know, this in a good way, and it's the outpouring of love that has come our way during this journey is, I mean, I'm probably going to cry right now because it's just been so amazing. So it worked. Thank you so much. Wishing you great health, abundant happiness, and outrageous love.
Thanks, guys.